My adjournment tonight is, or this afternoon, it is 1 o'clock, 1:05, noting that we sought to adjourn the House at 2:30 and that would have been just an hour and a half away with safe sitting practices. But my adjournment today is for the attention of the Minister for Health, and it relates to the orders that have been put in place in recent days. The orders that first of all said the more than 5 million Melburnians will be subject to a curfew from 9 p.m. till 5 a.m, and also the advice about playgrounds. And I seek specifically from the Minister for Health the release of the briefings and background documents on the curfew provided to him, or to his deputy, or to his delegate. Now, it's extraordinary that last year we sought this same information, and there is in place still an order from this chamber that requires the minister to provide those briefings to the chamber within 48 hours of a public health order being made. So I'm seeking, in a sense, compliance with that order of the chamber, and noting that more than 5 million Melburnians under the curfew are entitled to see the justification, the full health advice that is behind the government's extraordinary decision. Now, we've been in this chamber before to discuss curfews, and the evidence, the public health evidence on curfews is very poor. A number of public health officials have actually spoken, and knowledgeable people have spoken out in recent days about this decision to impose a curfew, and the public health evidence is not good. In fact, some of it is actually that curfews are negative. There is, and I've referred to this study in the chamber before, there are studies in the Middle East which show that where curfews are imposed, that it actually causes congestion. People congest in particular places, petrol stations, supermarkets and so forth, in the short period before a curfew time comes in. So what we saw last time, and what we will no doubt see this time, is Woolworths and Coles and Dan Murphy and the various petrol stations will have congestion in the last hour or two before a curfew time chops in. So we're artificially pushing people together in an unsophisticated way. So the public health evidence that I've seen doesn't support it. If the Chief Health Officer or the government has briefings that do support it, they should release them. So it's a very simple request: release the public health briefings, the background briefings, and any information that is relevant on this curfew. Victorians are entitled to see it. They are owed it.
Any further?